Love your morning coffee? Well, this is great because, of course, it can help you in relation to your liver, but it can also disrupt your sleep and it can cause problems with certain medications. Here's how to enjoy drinking coffee safely. No myths, no gimmicks. I'm Dr. Deepa, retired doctor and also a coffee lover. The question is, how does coffee affect us after the age of 55? Does it have an effect on our heart? Does it have an effect on our digestion? Does it have any effect on sleep? And if so, how much is too much? And how little is too little, possibly, for some people? And so these are the questions we're going to look at answering in plain English, no jargon. So how much is too much? Well, we recommend coffee to be no more than 400 milligrams per day. That's approximately 3 to 4 cups of standard coffee per day. And what is also recommended, of course, is to lower that if you're feeling jittery, if your heart is palpitating, you're feeling thumps in your chest, and of course, if you find it's affecting your blood pressure, if you're a patient on blood pressure medication, for example. And for those patients, it is important to make sure that you don't have any coffee for a good 3 to 4 hours before you do any blood pressure recordings, because of course the coffee can affect those. So in relation to heart health and blood pressure, coffee certainly does increase your blood pressure in the short term. In the long term, your body may well adjust to that, and you might find that it's actually fairly stable. However, we are concerned about people who have large amounts of coffee and therefore can affect their blood pressure ongoing. Generally not a huge issue if taken in moderation, but we would certainly advise people who are taking blood pressure medication to not take recordings unless you've had 3 to 4 hours break from coffee. In relation to your gut, and in particular in relation to reflux, there is an increase in reflux for some people who drink coffee through the day, and that is often eased off a little bit by having that with food, because of course that'll help to push down the liquids in your stomach. The other problem that coffee sometimes causes, of course, is a feeling of irritability in the stomach, and this again may be reflux coming up. And so once again, we would recommend having food, or you may have to take some sort of antacid to reduce that. There are some phenols in coffee which are beneficial to gut microbes, and as a result of that, coffee may well help with your gut health. As an interesting aside, for constipation, a morning cup of coffee is likely to improve things. So that's something that even I didn't know until this research began. In relation to your liver, observational studies have shown that in fact there is a little bit of a reduction in liver scarring and also a lowering in cancer risk. So that, we think, is a very nice thing. In the meantime, something which I didn't know until I began researching some of these things is that unfiltered coffee actually raises your LDL cholesterol level. Now this is quite significant because LDL cholesterol is one of the cholesterols that you don't want going up. You want to have that lowered if possible. And that risk reduction occurs if you have filtered coffee and also if you have granulated coffee. So that could be of great benefit to know. So interestingly, in regard to sleep, all of my studies that I've done for this article are in fact telling me that you should not have coffee within 8 hours of going to sleep. And this, I think, would be something slightly on the laughable side for most of us who have coffee throughout the day and who are absolutely not going to be within 8 hours. So I'll have to get hold of those researchers and let them know what I think. So in relation to bones, coffee's effect on calcium and vitamin D do not appear to be affected by having coffee. However, interestingly, and yet again another thing of interest to me, is that the condition glaucoma, which is of course an increased pressure inside your eyes, may actually increase with coffee. And as a result of that, we would strongly recommend, if you're in a situation where you may have this condition or suspect you have it, that you consult an optometrist or an optician. In regard to diabetes, your kidneys and exercise, they've discovered that there is actually a small reduction in your risk of type 2 diabetes if you're a coffee drinker, so that could be a nice thing. It's also well known that coffee gives you a small exercise boost, so once again, some benefits there from this lovely product. And who would have thought that decaf coffee actually has many benefits? Instant coffee is also fine, and paper filtered is apparently the best of all. So in relation to coffee and medications, interestingly, there are a number of interactions with coffee in regard to these artificial chemicals. For example, if you're taking ciprofloxacin as an antibiotic, and that's quite a commonly prescribed antibiotic, that has an interaction with coffee. If you're taking thyroxine for thyroid disease, then that also has an interaction with coffee. So it would be wise at this point, if you are a coffee drinker with any of those medications on your list, and there are quite a number of others which are listed in the description box, then obviously get to your doctor to find out how much coffee is safe or if you have to give it up. There are some myths surrounding coffee as well. Some of the well-established myths include that if you drink coffee you're going to get dehydrated, and we've now discovered that isn't correct. There are a couple of other myths going around, such as it increases your risk of cancer, and it appears that that is not the case, except in cases where people have very hot drinks, in which case there does seem to be some link with certain cancers and drinking hot coffee. So that's of interest because these aren't well-known things. The other myth was that unfiltered coffee was in fact healthier for you, but it appears that that is not the case. As you may recall from my earlier discussion about cholesterol, that has been shown to elevate LDL levels. So link is in the description below for all the research documents that have been used for this particular article. So please do have a look at those and you can gain further information. We have a personalised plan for you to consider. Maximum of 2 to 3 cups per day, usually taken in the morning or the early afternoon. Consider using filtered coffee, and of course if you get reflux, then it will be important to take your coffee with some food. And if you've got this far, please do subscribe to the channel. Please also like our videos and we'll keep making lovely content for you.